Olá, boa noite. Agradeço a todos a vossa presença nesta sessão de lançamento virtual do livro Viva a Vagina, de Nina Brockman e Ellen Stockendale. Juntam-se a nós nesta conversa o Dr. João Ramos, médico especialista em Medicina Geral e Familiar e apresentador da rúbrica Diga Doutor da RTP, e a Clara Não, nossa querida autora, ilustradora, influencer, ativista e reverente da causa feminina. Hello, good evening. Thank you so much for joining us. It's a pleasure to be here with you and talk a little bit of this book, which is really special for us as it is, I would say, a stone in the middle of the river, and hopefully it will get our message through to many women who need this help. I would like to start with a small introduction on how you two got so interested in this subject. I know you two met in college while volunteering for an organization as a sexual education teachers. I wonder if you were so overwhelmed by how little women knew about their own bodies. Was that what triggered you to try to discover more about it and write the book? Nina or Ellen?
Ellen, do you want to start?
Sure, I can start. Yes, Nina and I worked as sexual educators for several years, and like you say, we did discover that women from different cultures had far too little knowledge about their bodies, and we wanted to collect everything that we thought women should know about themselves in one easy-to-read book, and that is why we chose to write The Wonder Down Under.
João, do you feel that too? Do you feel that, do you get women in your office as a doctor to go there willingly to speak about these problems, to clarify some doubts they have?
In general, they don't want to talk about they want to talk about the illness, unfortunately, only about the illness, but I do my best. As I'm a family physician, we often receive women with these general problems, like the most common urinary infection, vulvovaginitis, and these many problems about the hormonal contraception and some of wrong ideas.
So
that's why
when there is a problem. Apparently we are having some technical problems. I wonder if Nina and Ellen, now that you are actively working, do you feel that? Do women get to you only when they have a problem?
Yes, I mean, that's normally why people go to the doctor. Unfortunately, they don't come to talk about all the good things and great things about being a woman and to tell us about how wonderful their sex life is. We would have loved that. But yeah, no, I work as a family physician right now as well. And just this day, I had a 40-year-old woman in my office crying because she thought her labia were too large. So I mean, this is something that we experience every single day, and it's not just young women who are having uncertainties about their bodies. It's also adult women who have kids and who have been going through their whole life being uncertain if they're good enough, if their bodies are fine, if their sexuality is good enough. So that was something that motivated us, but we still regularly have conversations. I mean, after having done this for several years, being shocked at how little women know, and also how easy it is to empower them if you just try and want to. And in a way, that's great, but it's also a bit sad when you see how easy it is to really change people's lives and people's self-confidence. It's just 5 minutes talk, and then you see their shoulders being like, I'm normal, and they're so happy. Yeah.
I presume you feel the same, Clara, though you work in a completely different field, but I feel that especially girls talk more freely with you. So do you feel that? Do you feel that they need to talk? Women want to talk about it, but somehow they are embarrassed. So sometimes it's rather easy to talk to somebody they don't know that well, or at least in person, but it's actually someone they feel, well, she's easy to talk about this. Do you feel that you have that commitment, that you do help a lot of women and young girls with these issues?
I believe I do, and people tell me that. Oh, this is not. And people tell me that it's easier for them to talk to me because I'm talking about it, and since I'm opening the dialogue, they feel free to talk about it too. Because I don't feel women are in general comfortable about their sexuality, and this is a problem that comes from all the society telling us that it's private, it's only for you, you shouldn't touch it or explore it or whatever, and that comes from way back, and we are just starting to really work with that now. There are women that never saw her vulva and never really just looked at it, you know. And then this gives this window for misconceptions, because when it's something that you can actually look at and see, and we see more and more books about it, like this one, and there is actually this profile on Instagram. It's called Vulva Gallery, where you can see all the kinds of labia there is, and different kinds of I say everything that is, because there is not one pattern to follow. There is, we call it major labia, and but maybe sometimes the ones that are supposed to be small are bigger, and that's okay. And Ellen and Nina talk about it on the book, like we should have more education about it, because everything changes with puberty and that stuff. And I feel that when I talk about it, people feel comfortable talking about it too, because I started it. So opens the window.
Alan and Nina, you two became worldwide known for the TED Talk you gave on the virginity fraud. Again, no matter the time or the place you live in, it appears that this myth still rings true to a lot of people, causing women enormous anxiety and distress. Even the medical language, the flowering, in Portuguese, it means the exact translation, gives you an idea that something is permanently changed, taken away, and then that women cannot regain control over it. Can you really tell by looking at a woman's hymen that she is no longer a virgin?
Ellen?
Sure. No, you cannot. You cannot tell anything about a woman's sexual story by examining her genitals. That's the story Nina and I are trying to tell with our TED Talk and what we're writing in our books. This myth is really old, and it's very common across cultures. And women in very different cultures today are affected by it. Some women, of course, are subjected to real physical harm or threats because of it, while others are only subjected to shame and insecurity. And it's so strange to us to think about how an anatomical misunderstanding can really destroy people's lives. And it's so strange that nothing has been done about this, even if the truth about the hymen, or the part of the body that is supposed to change if you believe the myth, that has been known the truth about this has been known in medical communities for more than 100 years, but still so many of us believe in these myths.
Maybe we should explain as well.
Yes.
Should we explain what it is?
Yes.
Yeah, because what we like to, a lot of people think that the hymen is like a seal, like a piece of plastic wrapping that's covering the vaginal opening. But in fact, what we like to compare it to is more like a scrunchie, like a hairband. And everyone, all girls know that this is stretchy, you know, you can open it. And that's the same for most women when it comes to the hymen. It can easily stretch open to make room for fingers or a penis or a tampon or whatever you would like to put up in your vagina. Some women do have tighter hymens or hairbands, and for those women, it might have to tear a bit to accommodate a tampon or a penis for the first time when you have sex, and then you have might have a little tear, and that might bleed a bit. But it's not like you lose your hymen; it just gets a little tear. And we just like falling or scratching your knee when you're a kid, you know, your body heals, and your hymen is no different from any other skin on the body. It heals, and it normally doesn't even make a scar. It's not possible to look a woman between her legs and see if she's had sex. That's the short version of the facts here.
Do girls talk about this, Clara? Are they afraid they won't be worthy if their hymen is not intact? We're not
No
hearing
sound.
you.
Microphone.
Is on mute.
Now it's good. Sorry. Generally, I see more women worrying about that. They get the slut label because they had a sexual history before, and I don't see that worriness about the hymen here. But I think that there are probably more, places in the world and cultures that are more strong about it. But here we see that double standard between sexual history in girls and sexual history in boys. That's more about it. But still, there is a misconception about the hymen. And I usually say that when you have these little skins that grow on your fingers, and when you take it off, if virginity was like that, we were constantly taking virginity off our fingers because it's just a skin. And there is actually that misconception about bleeding on the first time and not bleeding. And maybe if you didn't bleed, that was not really your first time. There is all this misconception about sex. And I actually don't think virginity should even exist as a concept. It doesn't really actually matters because it's a social construct, and we have to talk about this and this again and again. Yeah, I think sometimes people know that is a social construct, but they still feel the pressure that maybe I should do this or I didn't, or I think that's something you have to work from time to time with ourselves and others.
Yeah, we write about exactly that in our book, trying to define what sex is. I mean, it's kind of absurd when you think about it. If you go through your life as a lesbian woman and you only define sex as a penis in the vagina, you can basically have had lesbian sex your whole life and never had sex. You can be a virgin despite having been fingered or used whatever, you know, and you're still a virgin in that opinion. It's you can have, in certain conservative Christian communities in the US, it's very common to have anal sex for several years, but you're still a virgin because you haven't had vaginal sex, which is to most people just simply absurd. So the whole, we totally agree, the whole virginity concept, I mean, it's just ready for the garbage.
Yeah, and when people say that oral sex is a preliminary, it's just sad. And we also talk about this because sex is everything. Everything that gives you pleasure between two people can be sex. It's like even not penetrative sex. It's sex. So
It's doubly ironic when we consider what kind of sex is most pleasurable for women, because if you look at the science and if you look at where women's sexual organ is actually placed, it's not inside the vagina. Of course, we have the clitoris, which is located on the outside of the vagina. So for most women to get an orgasm, you need to stimulate a place that is not even located in the vagina at all. So the most pleasurable parts of sex is something that would not fall into the virgin or not virgin concept at all. So it's only about male sex and the female body as a vessel to be used by a man, which is also not a good concept for our time or for any time.
I think we can speak about blood, because there's lots of myths starting with this virginity concept. There are several men who bleeds in the first sexual penetration in the gland, but speaking about the blood, another myth I'm concerned, and as a doctor, as a family physician, and it's another big important myth in general in health, in general health. It's the skipping period. Lots of women thinks that the more blood the better, and I want Ellen and Nina to speak about this. This is a big myth for me.
Sure. What we think as doctors is that the usage of hormonal contraceptives is safe, and for a lot of women to skip the period is not only convenient but also good for you, since a period is actually a monthly loss of blood, which can cause you not only pain but problems like iron deficiency, or it takes a toll on your body to have your period, and to use hormonal contraceptives to skip that is safe, convenient, and sometimes good for you.
But do you think, I often hear that if you skip periods for a month or two, it will get harder for you to get pregnant afterwards.
That's another.
That is
another. And the other one is the more years you use anticonceptive pills, it gets worse and worse to get pregnant. It's another big myth in general, all over the world.
Yeah, using hormonal contraceptives does not affect your fertility. If you use some hormonal contraceptives, it might take a couple of months for you to get back your ovulation. But that's talking about a very short time. You don't get the lower fertility by using hormonal contraceptives. And it's also something I hear a lot in my office is women thinking that if they skip their periods, the blood would kind of like increase inside the womb and almost like overflow and start. It's almost like their body will be filled by blood if they don't bleed. And I laughed, and that's not nice. But the point is that when you're on hormonal contraceptives, it's kind of like your body thinking that you're pregnant, so it doesn't have to build a new lining of the uterus for a fertilized egg, because the body already thinks you're pregnant in a way. So it's not like it just keeps growing, it just stops growing. It's nothing that keeps growing when you're skipping your periods on hormonal contraceptives.
Getting back to sex and the first time, I would like to really stress that subject, because we hear a lot about men bragging themselves for their sexual activity, while teenage boys keep telling about their latest conquests in high school. And while girls, I presume they don't talk so much about it. They try to keep quiet, but I believe they keep questioning themselves on when is the right time to have sex. Nina and Ellen, you mentioned in your books that sex is a very lonesome thing, despite the need of two persons to have sex. When is the right time? Should a girl get into pressure just because everybody else has done it? What is the toll that if she does go ahead with it before, what is the correct body time to have sex?
Well, there is no absolute correct body time as long as you are as long as you feel ready and as long as you are mature enough to understand the consequences of your choices. Then you are grown enough to make choices for yourself and to decide what to do with your own body. And what we stress in our book is that there is no deadline to have sex. There is no rush. A lot of young women feel like they might be too late and feel like they might be later than their friends. And on the other hand, we have sexual pressure in the other way. Like you said, a lot of boys like to brag, boys and men sometimes like to brag about their sexual experiences, but for women, too much sexual experience can become an issue as well because of the virginity concept that we discussed earlier. Women are judged by their sexual choices if they have sex too early, if they have sex too late, if they have too much, if they have too little. So being a woman and having sex or not having sex is in the public opinion to lose before you even start. And that's the sad conversation about women and sex. We are judged no matter what we do. And our public conversation need to be focused on this and to open up so that women can make their own choices on their own premises.
So it will be eternal questioning when is the right time, because everybody will always have a saying, right? But,
yes, it's your own saying that really matters.
That should be the one who prevailed, exactly. Clara, I noticed you did a post on Instagram. I don't know how long you did it, but you did something like, it was a girl's conversation, and she was saying something like, wow, she slept with him on the first date. Such an easy one, that one. Mm-hmm. While on the other side, you had the boys' conversation about the same topic, and one was telling the other, yo, bro, you had sex on the first date? You're huge. So there's this big difference, isn't it? There's always such a huge pressure on women, and sometimes we know that they are lying about what they say they do, because most of the times they don't. But still in younger ages, that can be decisive, and it can make them go a little bit ahead of time, isn't it, Clara?
I think there is a double standard that is really bad for everyone, actually, because then you have people lying both sides for everything. And guys want to have a big number and girls want to have a small number, but sometimes they want to have a big number. Like Ellen was saying, we are judged by everything and by everyone, not only men, but women everywhere. Oh, yeah. And I think that when you are you talked about it, there is a movie, I tried to find it, but it's nowhere to be found here. It's called Just Via. She was the last one to not having sex, and she on the book, and she was feeling the pressure about having sex, and this is really real, and you don't want to be the last one, and sometimes the first one is like the cool one, and she knows more, and we want to know more, but then So that pressure is true, and I think guys talk more openly about it, and they are more open about masturbation too. Just now or these years that women are talking about masturbation, and masturbation is sex with yourself, so it's also sex, and that's actually one way to break the orgasm gap, because if you know what you like, you can tell, and you have to feel empowered and have self-esteem to say you're doing it wrong, it's not there, it's up or down and whatever, and I think that we have to start changing the system. You should feel more, if you have to feel pressure to know yourself, feel pressure to know what you like, instead of rushing yourself into something that you are not ready for, or you don't think you can talk about it, because then people will call you a slut, and we are always worrying about what people will think of us, instead of looking forward to what is good for us, and working on that.
I have a viewer here who tells us that Isabel, she mentions that there's still a lot of blame from on the side of women, because if they masturbate themselves. Mm-hmm. Shouldn't masturbation be a way for women to know their bodies, probably even before having a first intercourse with a man or another woman?
Yes, I mean, masturbation is one of our favorite topics, and we like to give it as homework. We always gave it as homework when we did sex ed in school. We told everyone to go home and masturbate as today's homework, because I mean, boys, they start masturbating when they're 9, 10, 11. A lot of boys start masturbating before they're even capable of ejaculating. I mean, it's something they do, and they're taught to do it by their pals. They talk about it in class. It's something they're proud of from an early age. And an exercise we often have in class is we ask them if they how many words they have for masturbating, and the boys can go on for 10 minutes, just. And a lot of really funny Norwegian sayings. We're a country that love our salmon, so one of my favorites is pulling the salmon. So it's all of these cultural sayings, and a lot of humor and fun around the concept of masturbating for boys. And then you come to the girls, and it's like, we don't even have a name for it. We say masturbating. I mean, it sounds like a medical, very technical, not very sexy thing you're doing. I think we almost never have had anyone have a good word for female masturbation. And it's so sad, because the female body is just as hard, if not harder, to sexually please than the boys' bodies. And if boys need to masturbate 1 to 3 times a day for 10 years before they learn how to have orgasms with girls, then why should it be any different for girls? Girls need to masturbate just as much as boys. I think one of the ways to get there is by starting to be more open and get the language for it, because as long as girls just do it by themselves under their blankets at home, and no one is open about it, then people think they're doing something shameful and something dirty, when in fact they're just taking responsibility for their own sex lives, which is a very important part of human health through all ages, also for old people.
It's also self-love, I think. It's really self-love. It's,
And one more thing. People often forget how healthy masturbation is. It's shown to. It's very good for sleep. It's very good for, it's actually been shown to be good for cardiovascular health. And it's also a good way to relieve stress. If you're stressed at work or school, it helps. And also it's shown to give girls and boys who masturbate have a much better self-image, more self-love. They appreciate their body for what it's able to do and not just how it looks. And I think that's the most important thing today's youth need.
Will people who masturbate have a happier sex life?
Yes.
Yes, definitely. The most important thing about masturbation is that it gives you all these things on its own. Like Nina said, it's healthy to masturbate, but also it's important to masturbate to learn how to have sex with other people. Because if you don't know how you work, how would you ever expect someone else to know how you work? Everybody is a mystery. Every body and every person is a mystery. And to learn how you work, you need to train, you need to exercise, you need to do your homework, and that's masturbation.
I think this is a non-topic at consultations you have, João.
Yeah, it's a non-topic. We live in these big different worlds, man and woman. As you noticed, you spoke about this pressure, that social pressure about everything, about early sex, late sex, and in Europe, parents, men used to take the kids to the ladies, and woman doesn't take their children to the boys. It's a big difference. And I'm speaking about Europe, even in Africa. I was born in Africa. It's another world, another culture. But women in general, those were some probably. That's why women are so anxious. And in 10 people coming to the hospital with anxiety, general anxiety, 8 or 9 are women, because women have this extra pressure about everything since they are girls. That this genetic predisposition with girls, by taking care to feed, genetic designed to feed, to protect, and to carry a baby. And that's why, in general, women are so anxious, potentially anxious. But yeah, it's a non-topic on the general medicine. But as I told today, I told to a lady, 70 years old lady, who doesn't know with how she get this urinary infection. They don't know where lives the most of the bacteria who can give you a urinary infection. They don't know Escherichia coli. They don't know Escherichia coli. It's a normal and good thing that lives in the perianal, in your bowel, and gets to your bowel, and that's why several women in each and every intercourse they can get this simple urinary infection. So in Portugal, we have the same problem with this. And in Portugal, we can have 40 names for male masturbation. 50.
Yeah.
But I don't think we do have a lot for the feminine masturbation.
Yeah, we have the same problem. We have to find this special word and sexy word for it.
Yeah, we have to find words. I'd like to speak about other myths that exist, namely discharges. I think it's a funny topic to clarify some doubts. We often hear that everybody knows that ladies don't break wind, and they don't smell from down under, right? When they do smell, it means that there's a poor hygiene, but it isn't so, is it?
No, it's not. And discharge is among our absolute favorite subject. Discharge is the liquid that seeps from a woman's vagina every day since she reached puberty. It changes during the menstrual cycle. Sometimes it's creamy, like body lotion. At other times, it's a clear liquid that's more like egg whites and stretchy. And this liquid can tell you what's going on inside your body. And it's not only educational in that way, it's also your dear friend because it protects you. Your discharge contain fabulous bacteria that keep the environment in the vagina acidic and protect it from dangerous bacteria that want to settle and give you infections. And it's also the body's ingenious way to clean the vagina on the inside. You never have to wash the vagina on the inside. You shouldn't, and you don't need to, because the vagina is a self-cleaning tube due to the discharge. So why is it important to talk about discharge? It is important to talk about this because a lot of young women feel like something is wrong with them because they have discharge. They feel like discharge is some kind of yucky liquid that they should get rid of, that is a sign of disease, and that is shameful. But it's really a magical substance that's helping you a lot. And we really want to talk about this and to tell women that discharge is good.
But not all discharges are good. So you have to be careful as well. And
yes, that's true.
Examine them. When should a woman be more careful to her discharge?
Nina, do you want to continue?
When women should be more...
what's a dangerous discharge?
Oh, okay. Well, let's start with the most common problem that women have is vaginal yeast infection. Then you can get like white, clumpy, like cottage cheese, like discharge. Yes.
And then discharge is bloody or green or yellow and it looks wrong. Then you should see a doctor.
And if it smells, weird and bad smell, then go see a doctor. I mean, we get this all the time. It's not weird for us. And sometimes it's nothing. A lot of women worry way too much about how they smell, but sometimes it turns out to be diseases that we can treat very easily. So instead of worrying, then come to us.
And itchiness also. Several times with this itchiness.
Yeah. But we also experience that a lot of itchiness is wrongly attributed to yeast infections, and that a lot of women overtreat with over-the-counter yeast products. And in fact, a lot of women, the itchiness and irritation that they can have on their vulva might as well be caused by local irritant or even allergies or eczema, because people are using way too much perfumed products. For example, when they're cleaning their underwear, we should all use hypoallergenic wash when we clean our underwear and not use intimate soaps with a lot of perfume. Water is enough, no perfume down there. It causes itchiness and it can give you allergies that itch.
Often I hear that when they have their yeast, we call a chlamydia, which is similar to the Latin word. People go to the pharmacy and just grab something and they take. And if it goes away, then they don't see a doctor. Do you feel that in those cases they should always go check their doctor and tell them what's happening?
Well, I think in this case, there might be a cultural and also a difference in how medicine views treatment for infections in Northern and Southern Europe. I might be wrong, but in Norway, we're really strict about over-the-counter antibiotics. So you would never, ever get treatment for chlamydia in a pharmacist without seeing a doctor, because over-the-counter antibiotic use, we believe, is increasing the resistance in the bacterial flora of our world. So was that the answer to your question?
I was wondering if you were mixing chlamydia and candidiasis.
Exactly.
Okay, yes.
You're talking about Candida albicans? Candida?
Exactly.
That's a
because that's something different than chlamydia. Chlamydia is a sexually transmitted disease. Yeah.
You can get over-the-counter treatment for yeast infections. It's often good to check with a doctor anyway, because just like Nina said, sometimes the patient is not the best person to diagnose themselves. A lot of itchiness and changes in discharge may be something else than the yeast infection, for instance, chlamydia, or just irritation due to perfumed products. So it's always good to see a doctor if you're unsure.
About the blood, I read something in the book that I found quite curious, and it's about the idea how many blood you lose in a month. And normally we have this idea that we lose a lot of blood, and then that nearly after having a period, I could use a blood transfusion. But apparently it's not like that, and it's not that terrible, is it?
Ellen, you're best on the math.
Well, tiny. If when we try to tell people the amount that one actually bleeds during a period, it's really good to use physical things that one has seen before. So the standard menstruation for 1 month is an espresso cup. It's about 30 to 40 milliliters of blood. It's a really small amount, and even if it feels like buckets and bathtubs, it's not like that at all.
A large bleeding is a double espresso.
Double espresso, indeed. If you bleed a cappuccino, you have, or if you bleed a double latte, that's a large coffee, right? Or tall or something. That's problematic.
That would be problematic. That's a bad one.
It's very problematic.
Then you should see a doctor.
And why women have to suffer horrendous PMS and pains?
Well, why we don't have a question, but we can explain what happens in the body. So when women have their period, we inside the uterus, in the endometrial lining, we have something called prostaglandins, and they're these small substances that communicate in the body, and when they're shed from the endometrial lining, they travel around in the body and they go to the brain and the gut and several places in the body, and they cause pain, they cause diarrhea, bloatiness. A lot of women feel like their stomach doubles in size when they have their period. It gives pain in the back, in the thighs, in the butt, in the stomach, and it can also give headaches and nausea in a lot of women. And all of these effects are caused by prostaglandins that come from the endometrial lining. And all of this is shed out and squeezed out into the bloodstream when the uterus contracts in cramps when we have our period. So what we care about one of the things, many things we care about is that women should use more painkillers and right painkillers. So non-steroid NSAIDs is like ibuprofen and
non-steroids anti-inflammatory. We call it
Yeah.
AINES. In Portugal is AINES, anti-inflammatories, não steroids. Non-steroid anti-inflammatories.
Yeah, so that's the best to use when you have period pain, and you should start taking it the second you start feeling pain. Not wait until you're lying on the sofa with 2 warm buckets of water on your stomach, you know, because then it's a bit too late. Then all the prostaglandins are all over in your body and causing havoc.
That's the same with headache. Neurologists say the same with headache. It's the same.
Yeah, it's the same. You need
can
to
use the ibuprofen also. Ibuprofen or type ibuprofen to people know is the most common one, but it's the same with headache.
Yeah, so stop the pain before it becomes bad, and then of course there are women who have more of a disease. If you have so much pain when you have your period that you have to stay home from school, stay home from work, it might be a disease called endometriosis, which is a very common female disease that very few women have even heard of, and even doctors often haven't heard of, which is one of the reasons why it often takes so long for women who have this disease to get a proper diagnosis. Diagnosis. It might, I think the average is like 7 or 8 years before people get the right diagnosis and also then get treatment. And there isn't that good treatments, but there is some. And so if you have really, really bad period pain, then see your doctor and check out endometriosis. I know that Clara has worked a lot on awareness about that in Portugal. Maybe you can...
Yeah, I'm connected with some women that are working with it. Actually, there is a law that was approved, and there is a really nice profile on Instagram. It's called O Meu Útero. It's from Catarina Maia, and she's like specialist on endometriosis that I know here in Portugal. And she has this list of doctors that know about it too, because as you said it, there is still a lot of doctors that don't know a lot of this and just have this kind of conversation that seems like we deserve the pain, or that is normal, the pain. And then women think that maybe this I'm supposed to suffer like this because it's my menstruation, but you are not supposed to just fall on the ground because of period cramps. It's not normal. And there is this misconception about pain, I think, that needs to be worked.
Yeah, sometimes I feel they have the idea that pain, the bigger the pain, the more fertile they'll probably be, because it belongs to the nature of being a woman, and it doesn't have to be like that. It's not, they're not related, I guess. So can we get on with our lives having periods while having our period? I remember the first time I had my period, my grandmother told me I shouldn't wash my hair, I shouldn't take long hot baths because I could drain myself in blood. Can we do everything we do on the other days?
As long as you feel up to it, you can. Recently, there have been women running a marathon with their periods not even stemmed by products like tampons and sanitary towels, to show people that periods are a part of women's everyday lives, and that we live with this 1/4 of the time, and that it's common and normal and natural and neutral, and something we should be able to see and talk about.
Do people still question you, João, about this? Namely,
I want to talk a little bit about I want to talk. I think in Portugal, as any country in Europe, it's important to speak about endometriosis. I agree with what you told about it. In my experience, we in national TV, in RTP, in my former show, every year we spoke about it, and every year it was like the first time, because woman doesn't talk. Some doctors doesn't know what is endometriosis, and I agree with you. I don't know our time in Portugal about the misdiagnosed, but I found some girls who are trying to get a proper diagnosis for 3, 4, 5 years. I know. Fortunately, I know 2 or 3 excellent doctors in endometriosis in Lisbon, and when women are concerned about the blood and the pain, it's I send them to this kind of endometriosis specialists. But I don't know Katarina Maya, but I know 2 or 3 expertise in endometriosis. I think I read on your book that 1/3 of the ladies with these several with severe pain, they might have endometriosis.
It's 1 in 10 women all over the world. It's a lot.
And don't forget that this special tissue, endometriosis, these special cells, they might go to other organs like the intestine, like the lung, even in the lung.
Yeah, like diaphragm.
This is rare, but in the umbilical, and they have to this kind of special surgery. But it's a complex and important thing to speak about it.
It is. Fortunately, nowadays people are talking more.
And it's an important cause of infertility as well, as you know.
Exactly. I have here a question from Octavia. She does pose the following question: how does hormonal contraceptives affect mental health? Does pills and DUs, IUD, do?
Well, this is a topic that we cover very detailed in the book. I mean, the book is we wrote it in 2016. It came out in 2017. So I can't guarantee that the latest research is in there, but we follow this closely. And what we feel very comfortable saying is that hormonal contraceptives, they are safe for the absolute majority of women to use, and most women do not get mental health problems from using hormonal contraceptives. That being said, there are some women who can have serious mental health side effects from hormone contraceptives. It seems like, I mean, this is a very difficult topic to study because mental health is so common and there are so many causes and intricate mechanisms to cause it. So it's not like breaking a leg where you can say what causes you to break your leg. A depression can have and will always have a lot of different causes, and it's difficult to pinpoint what triggered something. So that's why one of the reasons why research on this is difficult. But the big, I think it's 2 years ago, the biggest study on this came out. It's from Denmark, and it's a huge observational study that covered 1.5 million women, I believe, where they followed young women who used hormonal contraceptives, and they saw if some of them happened to get a depression that needed treatment by pills or by admittance to hospital. So we're talking pretty serious depressions. And what they saw was that amongst girls who didn't use hormonal contraceptives, 0.8 out of 100 girls would get a severe depression. Amongst girls, 1 out of 100, and then amongst girls who used hormonal contraceptives, it was 1.8. So an increase from 1 to 1.8 out of 100. They couldn't say anything about the causation, saying, you know, it was because of hormonal contraceptives. It could be other contributing factors. But that was the effect they saw on a large proportion of an unselected population. So we're talking about an effect, but it's for it's less than 1 person out of 100 who seem to be getting serious mental health issues. And with that in mind, we think it's very important that doctors and girls who use hormonal contraceptives are aware of this and also pay attention to their own symptoms and talk to their doctor if they think there is a connection. But we also need to chill a bit, because we are afraid that a lot of young girls are stopping the most effective contraceptives that are out there because they're afraid of something that is not that normal. We've seen that in Scandinavia, that a lot of girls were getting pregnant. Teenage girls were getting pregnant because they'd stopped their hormonal contraceptives because of fear of side effects, and used non-hormonal contraceptives that are not nearly as safe. So it's a balance between really taking women seriously when they say they're having side effects, because some are really having mental health side effects that need to be taken seriously, and then at the same time committing a serious a message that it's safe and it's good and it's effective for most women. I don't know if that makes sense, but it's a bit difficult. Yeah.
A lot, but it's a very important topic, because you also have the idea that probably those hormonal contraceptives can help you through mostly on the PMS. So it can go through the hard days before having your period. That can help you smooth things. So
yes, and for some
idea.
people, hormonal contraceptives, that's also, I mean, some studies have found that that women actually get less depressed on hormonal contraceptives because they're getting less PMS, less pain. All of these, they can have more sex, and they don't need to worry about getting pregnant, which is a major cause of problem, especially in countries where abortion is not available or illegal.
I think that even where it's legal, there's still always this stigma within that subject. Nobody tells freely that they will do an abortion, or that happened and they've done it. So it's still also a taboo there. So
what is the legal? How is it legal in Portugal now?
Yeah.
Yeah, it is until 12
fully
weeks.
legal or
well, legal till 12 weeks.
12 weeks.
Yeah. Fully legal until 12 weeks.
Yeah, that's the same as in Norway.
No, but it's no has few years, I guess, not that many years in Portugal. I would say a decade, 10 years. Well,
Yeah, I've worked with this my professor, my gynecology professor, was one of the major impulsioners here in Portugal. I think it's for about 8 to 10 years.
yeah. So
Yeah, we got some sad news from Poland today that abortion rights were made even stricter. So now it's completely illegal, even when the child is or the embryo is not even viable.
Yeah, it's really, really sad for everyone.
It's sad because a woman
It's
should know that.
unbelievable.
Exactly. Finally, one last question. Is getting pregnant a game of chance? Because the society pressure on women to become mothers is a no helper. Do you feel that also in Norway, women are almost obliged to be mothers?
Well, 2 years ago, our prime minister actually had a speech at New Year's Eve, telling all Norwegian women to increase the number of children she would mother. Yes, there is some outside pressure for Norwegian women to become parents or to become mothers as well. And I think in our society we still have a lot of prejudice against women who choose not to become mothers. We still think of the feeling that you want to become a mother, that is still seen as a default, and if you don't agree with that, then you may be seen as strange and different, and we think it's really important for women to be able to make the choice that she would like to live with either way. If you want to become a mother, then that's your choice, and if you don't want to become a mother, then that's your choice as well. But when it comes to being a parent, also biology is playing a role, and it's also important to remember that a lot of women may not be able to become mothers, and a big part of the pressure is also put on the pressure to become a mother and to want to become a mother is so large that we forget the huge amount of women who are struggling with this, and that is something we like to talk about as well.
Yeah, because there are a lot of women who cannot have children, and there are a lot of women who don't want to have children, and
Exactly.
right for them not to have. Their body will not change for not having children, right? Clara, what's your view on this take?
I think then when you pressure a woman to be a mother, and then the woman can't have children but she wants, then there is a really thing that worries me, because there is almost like this underline that says that you are only a complete woman if you are a mother, and that's not true. People say, "Oh, I made this." I made these interviews on some with women of several different generations, and there was this woman that told me, when I asked her what is being a woman, what does it mean for you, and she told me being a woman is being a daughter, and it's being a mother, and it's being a grandmother. And I asked her, weren't you a woman before being a mother? And she told me, yeah. So there is this thing that women belong to someone before being someone. And this pressure of society strengthens this so much that there is this pressure that you are even selfish if you don't want children. And your parents should be so proud of having grandchildren, and your little child maybe needs a brother or sister, and people ask directly, "Oh, it's time for you to give a brother to your child." And I'm always like, it's not up to you, it's my body, it's my vagina, it's my uterus, it's not up to you. I'm the one who decides that, not social pressure. But sometimes this social pressure gives anxiety, and it's really, really harmful for you and for your self-esteem even.
Do you have that pressure also?
Me?
Yep.
Oh no, I'm fine. But like I feel it around me, but I'm still young, so there is time. And I'm not those kinds of. I don't know if I want to or not to, and I know that I have a lot of time, and I feel pressure sometimes. People ask me stuff, but I just answer with humor, and thing goes away.
You do well. You do well. Well, It was really lovely having you all here with me tonight. Thank you so much, Nina and Alan, for taking your time, and João and Clara.
I'm gonna put my socks on. I'm gonna put my socks on.
You read the book.
Don't forget your homework.
Yes.
Thank you so much for this time.
Thank you for having us. It was really great talking to all of you.
Thank you
Congratulations
for being here.
again.
Thank you.
Obrigada
Bye bye.
a todos que estiveram connosco nesta hora de